vitamin D deficiency, and its serious impact on your health. Introduction to vitamin D. Vitamin D is called the sunshine vitamin. It's a fat-soluble vitamin essential for bone health, immune system support, muscle strength, mood regulation. Our body produces it naturally when exposed to sunlight. How common is vitamin D deficiency? More than 1 billion people worldwide suffer from vitamin D deficiency. It affects people of all ages. More common in areas with little sunlight, people with darker skin, those who stay indoors most of the time. Why is vitamin D important? Helps absorb calcium and phosphorus for strong bones and teeth. Strengthens the immune system to fight infections. Supports mental health by boosting mood. Reduces the risk of heart disease, diabetes, certain cancers. Keeps muscles healthy and strong. Causes of vitamin D deficiency: lack of sun exposure, staying indoors, wearing full clothing, or cloudy climates, excessive sunscreen use. Blocks UVB rays needed for vitamin D production. Darker skin reduces vitamin D synthesis. Elderly produce less vitamin D naturally. Liver and kidney diseases. Digestive disorders like Crohn's or celiac disease, obesity. Traps vitamin D in fat tissues. Poor diet. Not consuming enough food with vitamin D. Symptoms of vitamin D deficiency. Recognizing symptoms of vitamin D deficiency early can protect your health. Fatigue and feeling tired all the time. Frequent bone pain and muscle cramps. Mood swings, depression, and irritability. Hair loss. Weak immune system leading to frequent infections. Slow healing of wounds. Weight gain and difficulty losing weight. Poor memory and concentration, brain fog. Can vitamin D deficiency cause fatigue? Yes, one of the most overlooked signs is constant fatigue. Even with enough sleep, vitamin D deficiency can leave you feeling drained and low in energy. Does vitamin D deficiency cause headache? Studies have found that low vitamin D levels may be linked to frequent headaches. If you suffer from migraines or chronic headaches, checking your vitamin D levels could help find the cause. Vitamin D deficiency and hair loss. Severe hair loss, especially alopecia areata, has been linked to vitamin D deficiency. Vitamin D plays a role in new hair follicle growth. If you're noticing hair thinning or patchy hair loss, consider getting your vitamin D levels tested. How is vitamin D deficiency diagnosed? A blood test called the 25-hydroxy-vitamin D test. Levels: normal, 30 to 100. Insufficient, 20 to 29. Deficient, less than 20. Doctors suggest regular testing if you have bone problems, chronic diseases, frequent infections. Foods with vitamin D. Fatty fish like salmon, tuna, and mackerel. Cod liver oil, extremely rich in vitamin D. Beef liver, egg yolks, fortified foods, milk, orange juice, cereal, yogurt, mushrooms exposed to sunlight. Vitamin D supplement. Sometimes food and sunlight aren't enough. A vitamin D supplement is often recommended. Two types: vitamin D2, plant-based. Vitamin D3, animal-based and more effective. Dosage: 400 to 800 per day for general health. Higher doses may be prescribed for deficiency. Important: always consult your doctor before starting any supplement. Diseases linked to severe vitamin D deficiency. Rickets, a childhood disease causing soft, weak bones and deformities. Lack of vitamin D prevents proper bone development. Osteomalacia, adult version of rickets, causes bone pain and muscle weakness. Bones become soft and are more likely to fracture. Recommended daily intake of vitamin D infants, 0 to 12 months. 400 IU per day. Children, 1 to 18 years, 600 international units per day. Adults, 19 to 70 years, 600 to 800 international units per day. Seniors, 71 plus years, 800 IU per day. Pregnant dog breastfeeding women, 600 international units per day. How to prevent vitamin D deficiency. Spend 10 to 30 minutes under sunlight several times a week. Eat plenty of foods with vitamin D. Take vitamin D supplements if needed. Monitor your health through regular checkups. Stay physically active to maintain a healthy weight. Common myths and facts. Myth: drinking milk gives enough vitamin D. Fact: fortified milk helps, but may not fully meet your needs. Myth: vitamin D is only for bones. Fact: it's crucial for muscles, immunity, and mental health too. Myth: natural vitamin D can't harm you. Fact: extremely high doses of supplements can cause toxicity. Risks of untreated vitamin D deficiency. Higher risk of rickets in children. Increased chances of osteomalacia in adults. Fragile bones and frequent fractures. Higher risk of autoimmune diseases.